issues of staffing, healthcare, and wages. We worked very hard today on a proposal to give Catholic Health. The bargaining committee is currently meeting now, and our goal is just to work as hard as possible to reach an agreement as quickly as possible with Catholic Health.
What are some of the issues that you guys aren't seeing eye to eye on?
I would say at this point the biggest issue is staffing. We just want to make sure the hospital is safe for our employees and for patients, and wages.
Can you elaborate a little bit on staffing? Is it shortages? Is there not qualified people?
We just don't have enough staff, and we haven't been able to retain staff with the wages that we have right now.
Could you just further elaborate, because Catholic Health had said that they were increasing staffing by 10% about a week ago. Is there a specific figure that the union is looking at?
We're proposing fixed ratios and a commitment on staffing. Their proposal is about targets, and it's not about fixed ratios.
What's the exact ratio you guys are looking at?
It varies by floor, whether you're a med-surg nurse or you're a critical care nurse. We also have proposals on the table for nurses' aides and environmental, radiology, and respiratory.
How much work would you say the union has left, and how long do you think that could take?
I mean, all I'll just say is that the parties, the union's committed to working as long as it takes to reach an agreement. We're just going to keep bargaining.
When you guys do eventually reach a deal, how will you then make the transition with all the members back to work?
Our goal is to get the members back to work as quickly as possible. We feel that the patients are going to get the best care from our members, not from the replacement workers. We're hearing a lot of stories about the poor care in the hospital right now with the replacement workers, so we will work in partnership with the hospital to get our members back as soon as possible.
Yeah, can you elaborate on that? Because that was my next question, is what are you hearing about patient care inside Mercy Hospital right now?
Well, we've had the story of the patient who came out of the hospital. We've just heard that the quality isn't the same as people had with our members. I've heard reports of falls, medication issues, and so we care about the patients and the community, and we just think it's so important to resolve this contract and to get our members back in the hospital as soon as possible.
And when you talk about the staffing ratios that you like, how common is that to be written into a contract? It's kind of a fairly rare occurrence.
So New York State just passed a law
Right.
that mandates that the hospitals sit down and bargain ratios with us, and so that's what we're asking. We're asking them to sit down and bargain ratios, to follow the law and to bargain ratios.
And of course that doesn't go into effect 2023.
Right.
So position, let's get it done now.
Yes.
Before we
Yes.
get to 2022, before you know it, and here we go.
We're in bargaining now, so now is the time to do it. And what I will say is that from talking to our members, staff has been leaving because of the staffing conditions in the hospital. They're frustrated for not being able to give the care the patients need, and that's why people are leaving and going elsewhere.
Has there been an agreement on wages?
There is not an agreement on wages.
But is that still a sticking point?
It is
still.
still.
You talk about staffing, but our wages, where's the progress at on that?
We're just back at the table today. So I would just say that right now we're just having positive dialogue, and that's as far as it's gone today.
Both sides here, talking all day, part of the day. How was it?
Both sides have been here all day.
You're talking about adding people or filling jobs or whatever, but there's an actual shortage of nurses and all the other medical personnel. Where are you going to find them?
So I'll just tell you what I'm hearing from our members. Our members have been so upset about the conditions in the hospital that they're going to other hospitals in Buffalo. And so we want Catholic Health to have the wages and conditions that are necessary in order to retain our staff. That's not happening right now.
And you know how long has this been a crisis for the staffing? Catholic Health will come back and say, we have some of the best ratings of any health system. Which makes me wonder, did this just happen start of the pandemic, or was it always there?
So in 2016, we bargained some really good staffing language for Catholic Health to hire additional employees. They did that for 2 years, and then after that 2-year period, the staffing levels started to decline. So we've been seeing a decline in our numbers from 2018, where we've lost about 300 staff.
Over the weekend, it seemed that, at least just from the press releases we were getting, that tensions were kind of increasing. So you already talked a little bit about it, but can you just talk about how, with both parties being at the table today, what tension was like in just the first day back at the table?
I just think both sides were very respectful of each other, and I think both sides are committed. I'm hoping that both sides are committed to reaching an agreement.
Has there been conversations with the picketers about just behavior out there? Because everyone saw the TikTok video that was shared by Catholic Health also. Has there been a conversation just about people's behavior there?
What I'll just say is that we're personally really concerned about Huffmaster's behavior. We think that they've been agitating people, saying sexually inappropriate things, trying to antagonize our members. And if you do any research on Huffmasters, there's a lot of documentation that this is their tactic to try to agitate union members.
Based on what you're saying, it seems that, obviously there's people here that were supposed to speak that aren't. Are you guys pretty far off? Do you think this is going to go on for a long time? How far off do you think you are?
We have a lot of work to do. I'm not going to minimize it, but I think that if both sides are really committed to reaching an agreement, we can get it done, and we can do what's best for our members, for the patients, and for the community, and have everyone back in the hospital.
And as a union, how much give are you guys willing to give, I guess? How much are you willing to let go of what you want?
We just want a fair contract that's in line with the market, and I will tell you what Catholic Health has been paying and what their staffing levels have been are not in line with what's happening in the market.
You said you lost.
It's just the beginning, so I really can't speak on that. I think it's just important that both sides are at the table and we just keep pushing to reach an agreement.
How long will you guys be talking for tonight?
I'm not sure how long we'll be talking for. We have a member update tonight, but the union is committed to being here as long as it takes to reach an agreement.
You said you lost 300 people at Mercy. Is that a net of 300 or 300 people left and will be replaced?
It's actually probably more than 300 people. I just know how our membership numbers have declined from 2018, and so the hospital's been hiring people throughout that process, so we probably lost over 300 people over that period. But right now our member numbers are 300 lower than they were in 2018.
Nurses and all the rest.
Yes, correct.
How long can this all go on before, you talked about poor hospital conditions already, but before things get even worse, to the point where if I was, to get injured or something, I wouldn't want to go to Mercy?
What I'm hearing from people inside the hospital is that it isn't the best place to be right now. So, we just think it's most important that we get our members back to work.
If the strike ends anytime soon, will the workers go immediately back, or is there some kind of role between those temporary workers and you folks getting back?
We'll have to negotiate an agreement to get people back into the hospital, so I can't really speak to specifically what that will be.
I know one of the concerns was that Mark Sullivan really has not been present. People were hoping to see him at the bargaining table, or also just being out there among the strikers. Have you seen him at all since this started?
We haven't seen him at the bargaining table since this started, no.
Anything else you want to add? Thank you.
Thanks, Aaron. Appreciate it.
Thank you.